The information on aging better in uncertain times is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Medical cannabis. We've learned a lot about medical cannabis and its physical benefits as people consider it as a possible alternative to their current medical therapies. But what about the psychological benefits of medical cannabis? Today, we're going to talk to a member of the Wounded Warriors and Canadian military veterans and the experiences they have had with CBD and their medical conditions. I'm Gord Martno, and welcome to another edition of Aging Better in Uncertain Times as we discuss all aspects of aging better. We have with us today a member of the Canadian Armed Forces Wounded Warriors and the Patient Care Centre and an expert in PTSD and medical cannabis. First, let's get to our resident medical specialist, Dr. Fabio Varlese. He's the chief of medicine at Runnymede Hospital, as well as an assistant professor of geriatric and internal medicine in the Faculty of Medicine at the University of Toronto. Dr. Varlese, we've been speaking all along about the physical benefits of CBD and how it relates to people's medical conditions, but what about the psychological benefits? There are people and many advocates, and one of them is here with us today to discuss the physical and psychological treatments together that CBD and medical cannabis can have.
Well, thank you, Gord. I'm really looking forward to today's episode and to get to meet Aaron more and the work that he's doing. I must say that when it comes to post-traumatic stress disorder, there are clearly symptoms in the realm of clinical psychology. But with post-traumatic stress disorder, you actually have both physical and psychological, emotional symptoms that you have to address. And I feel that medical cannabis would, in fact, address both types of symptoms. And as mentioned, there's a lot of clinical research happening. We're going to hear about some of the trials that are being conducted. But I feel that it's really the combination of psychological and physical symptoms that we address when it comes to PTSD.
Doctor, thank you. Aaron Victory is an ambassador of the Canadian Wounded Warriors Project. He's also an advisor to the Chronic Pain Care Centre and the Heroic Hearts Project. Aaron, welcome to the show today. You know, we've been discussing CBD and medical cannabis for some time and its benefits, but now we're into the psychological aspects. How did you become involved with the study of psychological aspects of medical cannabis and Wounded Warriors?
Thanks very much for having me. So was served 14 years in the Canadian military. That was in an infantry battalion, the majority of that time in reconnaissance and sniper subunits. And from there, I medically released in 2016 and started consulting in the medical cannabis space. So the history for coverage for veterans in cannabis goes back to 2007 when Veterans Affairs gave the first veteran access to therapeutic medical cannabis on compassionate grants.
Aaron, what's the history of cannabis coverage for veterans in Canada?
The history for cannabis coverage for veterans in Canada is that we remain an anomaly in the medical cannabis space, where we're the only demographic with blanket insured coverage for $8.50 a gram per dried flower, ostensibly through Veterans Affairs, but through Medavie Blue Cross. There's currently 14,000 plus Canadian veterans who have their medical cannabis covered in that way. And they generate, last year the numbers were $89 million, and this year it will be the first time that it cracks a 9-figure number. And to put it into perspective, the entire medical market in Canada is about $600 million over the last 12 months. So a very trackable percentage of the market is veteran cannabis patients.
Aaron, how widely known is it that Canadian veterans can access CBD and medical cannabis for their conditions? I mean, does the average rank and file member of the armed forces know about it? Are they aware of how readily available it can be?
Absolutely. It's well known amongst the veteran community that we have coverage, the 100% blanket insured coverage through Medivie Blue Cross. And that's usually gained through access. And this has been going on since 2007. But then in 2014, restrictions were lifted in terms of the type of conditions that medical cannabis could be granted. And as well, general practitioners and not just specialists were allowed to prescribe cannabis. And then that really grew the awareness of the fact that veterans, for certain treatment resistant and chronic conditions, both physiological and psychological, could avail of the Veterans Cannabis Reimbursement Program.
So, was there a eureka moment in the study of PTSD and the use of medical cannabis and how they might be beneficial? I mean, was there a specific time when it all sort of came together?
I think actually we're still waiting for that moment. So the randomized control trials and the observational studies are continuing to happen to compile the data to say that. But I believe that of the emergence of so many veterans using medical cannabis came because they had tried other treatment options and just not had not seen the results that they had wanted to see, and then figured that it would be worthwhile to try a less traditional source.
Dr. Verlese, we've been discussing access by members of the general public to medical cannabis for the treatment of their medical ailments and access to members of the Canadian Armed Forces as they deal with PTSD. But access is something that certainly needs to be discussed here because, it's not that widely known that people can access easily CBD and medical cannabis for their conditions. And that includes members of the armed forces. So we need to update the access information.
Well, there's no doubt. I mean, the initial approach of the medical community when it comes to addressing PTSD, it's a long list of physical and psychological symptoms. Physicians traditionally look at the condition pharmacologically with the well-known medications that are available, and they use the non-pharmacological approaches also to be combined in the care plan. Medical cannabis, as it becomes more and more available, we know that there's a lot of personal, subjective type of benefits that patients talk about. But as mentioned, clinical trials are underway as we speak, and everybody is truly anxious to start seeing the types of outcomes that makes medical cannabis more of a standardized and normalized approach in the management of PTSD.
Aaron, you're widely accepted as someone with a great knowledge base of medical cannabis and how it can be used for the treatment of medical conditions. But, it had to happen personally. So there had to have been some sort of personal moment for you to get involved in the study of CBD and medical cannabis for PTSD, for example. So tell me personally, what happened to you and how did you deal with it?
I have been a medical cannabis patient since 2014, but I would hesitate to say, that medical cannabis was, the end all be all. I think it's a powerful tool to utilize along with other modalities and treatment methods. And for myself personally, and a lot of, I'm 39 years old. I was a Haiti, Afghanistan veteran. So the global war on terror generation, I think we're more open to more non-traditional methods such as, meditation, breath work, mindfulness, the connection between mind and body. And honestly, medical cannabis is just like anything else. It's not going to be a cure-all, but it can most definitely be a tool in the toolbox.
So, Aaron, you've witnessed other members of the Canadian Armed Forces with medical ailments and PTSD, for example, as we specifically get into the area of psychological benefits. So, do you say to them, I had this or that condition, and I had this or that kind of problem, and this is how it helped me? Is that what you do?
Well, CBD and THC, to be honest, Gord, and my opinion on whether medical cannabis works or doesn't work, it's kind of unneeded at this point in the veteran communities. Like I said, since 2007, veterans have been getting blanket insurer coverage, and then in 2014, it started gaining more wide acceptance in the community. So the veteran population remains one of the most educated populations on medical cannabis use in terms of consumption methods and dosing, but that's why I'm glad that shoppers Drug Mart is developing a veterans focused program, because I think that information on consumption methods and dosing coming from a pharmacist would be the 100% solution for the veteran care.
Aaron, dosage is something we've been talking about throughout our podcasts with medical cannabis and CBD. The problem is, how does a person arrive at a specific dosage that will, benefit them in the treatment of their specific ailment? So now, with psychological benefits, how does that happen as well? How do you arrive at a specific stage and say, okay, this is the right amount for me? How did you get there?
Well, that's in the early days. There was a lot of trial and error, because in 2014, when I became a patient, and the majority of veterans avail of the cannabis program through veteran focused cannabis clinics, and that's where I started as well. And there's differences in the level of education from clinic to clinic. So I was lucky that I landed with one of the few physicians in Canada who was actually comfortable prescribing medical cannabis at that time. And he educated me on the dosing and consumption methods, and, a sublingual oil versus dried flower versus combustion versus vaporization. I think it would be, because Shoppers Drug Mart right now, veterans not only have coverage for dried flower for $8.50 a gram, but for all consumption methods. So whether that's a vape pen or sublingual oils or gel caps. So I was lucky in my own personal experience where I had a physician guide me.
Aaron, there are a couple of aspects to this discussion that need more exposure. And what we want to get into is not only how CBD and medical cannabis can benefit people's medical and psychological conditions, but it's how they do it. I mean, there are so many different applications. There are patches, there are oils, there are lotions. Are members of the armed forces aware of the array of products available?
Absolutely. And, again, with Shoppers Drug Mart, this is the difference as well, because they, some licensed producers, because of the amount of cannabis that veterans consume, and because, it is a large segment that makes up the actual medical cannabis market. So the veterans are well aware that they have coverage for things outside of dried flower. And Shoppers Drug Mart is an anomaly in the space, as they have 35 licensed producers on the same platform. So instead of a veteran remaining at a single source licensed producer, they have access to 35 different brands and then multiple SKUs within each brand. And there's everything from topicals to sublingual gels to gummies to vape pens to traditional dry flower.
Aaron, did you have in your discussions with members of the armed forces for the treatment of their ailments, be they physical or psychological, the aspects of CBD? Did you have members saying to you, you know what? That's that cannabis stuff. I'm not going to smoke that because I don't want to. Are they aware that smoking or combustibles is not necessarily part of the whole situation?
Absolutely. In the earlier days, that was a prevailing attitude amongst a lot of the active service members. And then, a certain generation was just, cannabis does still have that stigma, in terms of when they hear medical cannabis, they think somebody consuming a joint or from a combustible source, where you can have multiple different applications. But that is something that you're seeing less and less of.
So, Dr. Varlese, you've had these discussions with your patients, many of them thinking that CBD and THC have to be ingested by smoking. In other words, the combustibility of ingesting the product. They're not aware of that there are lotions, there are patches, and a total array of products. So you inform them, and so enlightenment is one of the issues here.
Oh, absolutely. I mean, there's no doubt that we're right in the midst of changing the way medical cannabis is perceived by society. I feel that a lot of information is being offered to the public. The medical community itself is affected by the stigma, and I feel that the various specialized courses and programs that doctors today are taking part of is going to contribute to the more appropriate use of medical cannabis with their patients when they're looking at alternatives, when they're looking at options in terms of pain management or tapering off opioids and looking at other alternatives. Patients and physicians, I think, are affected by the stigma. But I very positive about how society is slowly changing, but a lot of it has to do with the clinical trials that need to show the types of outcomes that give the reassurance that we need in order to really make it a standardized treatment.
Aaron, what was it that sparked your interest in CBD and medical cannabis to treat your ailments? Was there a specific time when you said, okay, I'm going to try this? And what was it that drew you into that whole scenario?
Well, I actually found out through word of mouth about one of the early veteran cannabis clinics, and then that I originally started as a patient, and then was out of the military about 2 years after, and realized that from a corporate or a business perspective, that veterans were the again, I feel like a parrot, but the only demographic with blanket insurer coverage, which makes them from again a corporate perspective of a valuable demographic. So I started working with licensed producers and cannabis companies in aggregating veteran patients and educating veteran patients that they do have that distinct type of coverage.
Aaron, would you say that Canada is sort of a leader in this area of investigation because you're pretty happy with the way things are going?
Yet things could always be better, and I'm not going to say that Canadian veterans don't have their own sea of bureaucracy to wade through when they do deal with Veterans Affairs Canada or other organizations at the federal level. But Canada is the only, like, to say that we're leading is a understatement. So we're the only country currently that covers our veterans medical cannabis.
So, Dr. Varlese, we learned something positive today, something I was unaware of. So, not only is Canada a leader in CBD and its possible implications for medical conditions, but the psychological aspect as well. This is something I was unaware of.
Oh, absolutely. I'm very impressed with how Veteran Affairs is really focused on addressing PTSD, considering medical cannabis, and making it available. There is a tremendous amount of evidence that is very subjective with patients that we see every day that will claim medical cannabis being very, very helpful in various types of symptoms, both psychological and physical. And therefore, I certainly welcome, the work that is being done in Canada. And clearly, first responders, no different than veterans, are affected in high numbers from PTSD. And we've seen a rise in this during COVID-19, where the call to duty has really made PTSD even more of a prominent issue. So I'm very hopeful with the future.
So, Aaron, in your work with wounded warriors, have you had soldiers coming to you and saying, I'm so glad I discovered this because I got my life back on track, and they give it a kind of endorsement? Have you had any of those discussions?
Absolutely, not just through Wounded Warriors either. You hear that from a lot of veterans who are on the traditional SSRI or opioid path pharmacologically, and then they take medical cannabis. And like I said, I'm not saying it's a cure-all or it's for everybody, but there is there's a marked distinction in the veterans that avail of the medical cannabis program and then reduce the amount of traditional pharmaceuticals that they take.
So, Aaron, in your work with wounded warriors, where do you see the future? Like, where do we have to go in these studies? What's your roadmap to the future?
I think in terms of plant-based therapeutics overall, that you can include psychedelics in the conversation as well. And I know we're speaking specifically about medical cannabis here, but with what the evidence that's being compiled with psychedelics, specifically psilocybin and its effect on certain psychological conditions, I believe, and the Legion's Veterans Village and the Node Group in British Columbia just are going to establish a standalone center of excellence, and they are going to be exploring the plant-based therapeutic approach.
Aaron, thanks very much for your contribution to the discussion today. We sincerely appreciate your time and also your encouragement of members of the Canadian Armed Forces to consider the possibility of PTSD and CBD as its treatment and the future. Thanks very much.
Thanks very much for having me on, gentlemen.